Sure. I mean, it became very clear very early on that just look at the average patient who's undergoing a total joint procedure.
Mhm.
Usually, they're not nearly as healthy or active as people who are not in the operating room for the same procedure, meaning that it's obvious that, sure, genetics plays a role, but so does our overall health, including what we feed ourselves and how much that we move.
Mhm.
And it, yeah, it also became very clear that those who were active before surgery and didn't wait until they were too run down, they always did better and recovered faster than those who waited a little too long or didn't receive any prehab, didn't receive any nutritional counseling prior to surgery. So, and this has only become more clear the further along that I go. My goal is not only, it's not to do 10 cases a week, it's to make sure that the cases that I do, the people can recover from, and I've optimized them to, to a point where I'm going to minimize their pain and suffering from a complication, my pain and suffering from the complication, and my hospital's pain and suffering from a complication.
Mm.
So it's become more and more clear over the years just how important these lifestyle interventions are pre and post surgery.